Over the years, the rapid development of our infrastructure has limited physical activity and increased the required amount of time sitting. Nearly 6 in 10 working adults were estimated to use a computer on the job during a typical 9 a.m. to 5 p.m. schedule. As such, the average American spends 70% or more of each day sitting either at work, school, or for leisure activities such as watching TV or surfing the web. According to the NIH, sedentary practices such as prolonged sitting increase risk for lifestyle diseases which are not mitigated through physical activity and diet. This means that you could spend 6 hours sitting, 6 hours weight training and exercising, and you will still be at an increased risk for lifestyle diseases such as sitting down. Habitual sedentary behavior has been specifically identified as a risk factor for cardiometabolic disease. However, there are ways businesses can address these issues for the benefit of the company. Better employee health can increase revenue and productivity, decrease healthcare costs, and attract talent to the company. Step Up for Your Health is an intervention program that attacks the individual, interpersonal, and community levels in order to promote a decline in sedentary behavior. Here's how it works. In order to consider the effectiveness of our program, Company A will receive the intervention and Company B will serve as our control group.
Company B will receive access to company Fitbits, which they can choose to use while still employed at the company. Furthermore, they will be provided a list of exercises that they can do while at work. Similar to the control, Company A will receive office Fitbits. Based on previous studies, e-health devices are known to work because they're interactive and convenient. What if you are provided with stations where you could not only get your daily workload done, but additionally get some physical activity? Implementing standing desk and treadmill stations will get people moving by breaking down the perceived barrier of taking time out of work productivity for exercise. We will further implement a competition dividing Company A into 3 teams according to 3 departments of similar size. Each team has 3 months to put in as many steps as possible. To keep workers engaged, each member of the team with the highest average number of steps will be rewarded a monetary bonus in addition to free Fitbits. Losing teams will be able to purchase their Fitbits. This way, all workers are still encouraged to reduce sedentary behaviors while they're out. We believe that access does not directly lead to action. Simply implementing Fitbits and treadmill workstations in the workplace is not enough. In order to orientate workers to our physical activity intervention, we will provide in-person workshops that will cover the benefits of using these resources.
In order to assess the outcome and impact of this intervention program, we took multiple measures to ensure the program was implemented as planned, to study the change in behavior and to determine the impact of the overall issue. These measurements are determined by objective and subjective techniques. A self-reported health profiles for workers before the beginning of our study will serve as our baseline. Related information include reported time sitting and medical history. Objective measures throughout the competition include data extracted from Fitbits. Upon the finish of the competition, both objective and subjective measures of sedentary behavior and physical activity will continue to be measured on a monthly basis for 6 months to see if workers continue their trend at reducing sedentary behaviors while at work.
In order to combat these barriers, Step Up for Your Health plans on using face-to-face educational workshops and tech and text-based intervention channels via Fitbit and text message reminders. For the individual, we will educate the target population regarding the health dangers of sedentary behaviors and demonstrate that health outcomes can positively and easily be changed through increasing physical activity. At the interpersonal level, we plan to work at changing the social norm that everyone sits at their own cubicle and involving coworkers encouraging one another through team building and friendly competition. And at the community level, by creating access to means of physical activity, this lessens the constraints of finding time for physical activity outside the workplace.
The health belief model explains people's likelihood to participate in a prevention program. We want to demonstrate the benefits of physical activity and increase the motivation of employees to make this behavioral change. The perceived benefits are teaching the employees the health benefits of being physically active. The perceived susceptibility provides accurate risk information about not being active. For perceived barriers, we'll teach problem-solving skills. The keys to action will include a monthly face-to-face meeting and workshop, as well as Fitbit reminders.
In addition to the health belief model, we will be using the social cognitive theory to guide our intervention. We will be focusing on applying vicarious learning and influencing self-efficacy to educate workers on the risk of a sedentary lifestyle and the importance of physical activity. We will try to motivate them by showing them ways in which they can implement changes in their daily life and by setting goals along the way. By having managers and those in higher positions also participate and be the leaders of the group, they will serve as role models to the others around them. The basis of this theory can be explained through the concept of reciprocal determinism. Reciprocal determinism states that a person's behavior is influenced by the environment, behavior, and individual factors.
We are hoping this will help people in the workplace change how they spend their time during their work hours. With a little help, we all can step up for our health.